The most littered object in the world contains the drug attributed to the most preventable deaths. Introducing the cigarette. Just as tobacco pollutes our earth, nicotine pollutes our bodies. Hi, I'm Becca, and today I will do my infomercial for HSC 427 on nicotine. What is tobacco, and what is nicotine? Tobacco is found in the plant Nicotiana tabacum. The leaves are harvested and dried, and are shredded and remoisturized with other chemicals. Tobacco is then packaged and stored for 1 to 2 years before moisture is added again and tobacco is blended with other varieties. What is nicotine? Nicotine is a colorless, highly volatile component of tobacco. It is one of 4,000 chemicals found in smoke from tobacco products. It's a highly addictive substance that increases dopamine, or the reward pathway of the brain. How people consume nicotine differs. It can be consumed by smoking cigarettes, cigars, hookah, using chewing tobacco, or snuff, which is when it is inhaled through the nasal cavity. When smoking cigarettes, nicotine enters the lungs and diffuses into the bloodstream. The smoke reaches the brain within 10 seconds of inhalation. The typical smoker takes 10 hits of nicotine per cigarette. When people smoke cigars or use chewing tobacco, it is absorbed through the mucous lining of the mouth. How nicotine affects the body. While the consumption of nicotine may differ, the end result from long-time tobacco use is going to cause damage in some form or another. Cigarette smoke contains over 4,800 chemicals, and at least 69 of which are known to cause cancer. Some of these cancers include lung cancer, mouth cancer, kidney, bladder, and colon, just to name a few. Nicotine increases your chances of developing pneumonia and chronic neck pain, as well as COPD, or chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. The two diseases restrict airflow, slowly suffocating the smoker. Additionally, it can cause cataracts, increase the risk of heart disease, stroke, and heart attack. Ultimately, it causes premature death. Although the media glorifies smoking and makes it look attractive and alluring, there is nothing attractive about what nicotine actually does. If the thought of developing preventable diseases wasn't enough, consider the other effects not talked about as much, such as periodontal disease, also known as gum disease. Smoking increases the risk of gum disease, which is a severe chronic bacterial infection that can result in tooth loss, gum recession, and bone loss. Interestingly, periodontal disease has been shown to be linked to other possible medical problems, like heart disease, stroke, diabetes, and other respiratory diseases. There is also the risk and likelihood of impotence, also known as erectile dysfunction. Smoking can damage blood vessels, resulting in poor blood supply everywhere. Research shows that those who have smoked have higher odds of getting ED than those who have never smoked. Tobacco-related deaths kill more people than deaths caused by HIV, illegal drug use, alcohol abuse, suicide, car injuries, and murders combined. Tobacco-related deaths claim over 443,000 lives a year. The good news? Stopping today has immediate benefits on your body. If you quit by age 30, it reduces your risk of dying of tobacco-related causes by 90%. If you quit by 50, your chances go to 50%. If you quit, you're no longer putting the ones you love in the toxic clouds of secondhand smoke. Your sense of taste and smell return, and you save a lot of money At $7 to $9 a pack, this adds up exponentially over time. So what happens when you quit? Your heart rate drops to a normal level after 20 minutes. Your lung functions begin to improve after 2 weeks to 3 months. Coughing and being short of breath begins to cease after 1 to 9 months. And your risk of having a stroke is reduced to that of a non-smoker after 5 to 15 years. For more information on this, visit the link below. This concludes my presentation. Listed are the references where I got my facts, and I hope now you're wondering, just like me, why anyone should choose to continue to smoke and potentially think about quitting if you're a current smoker. Thank you very much for your time. Have a nice day.